Hey guys, Jamie Krebs here. Day 2 of the pineal gland cyst vlog. Um, not much news. I don't have my surgery date yet. I talked to the coordinator at the neurosurgeon's office this morning, and I should have the date by tomorrow or Monday at the latest, and then I'll be able to update everybody on when that's being done. But one thing that many of you don't, most of you newcomers are not going to know about me, just some friends that are following know, is that I have a chronic disease called chronic pancreatitis. And mine is caused by a birth defect of the pancreatic ducts. They're very small and twisted and full of strictures and nasty little boogers. And so because of that, I have to take pancreatic enzymes to be able to eat meals without pain and digest them properly, and I tend to suffer from dehydration a lot and some blood sugar issues and pain. And I'm very much I try to do things holistically if I can. I don't like opioids and things, so what I do is I do home IV hydration, because hydration is very important with pancreatitis. So I do home IV hydration. I use non-opioid pain meds and nausea meds as I need to. And then if it's really bad and I just can't take it anymore, and my other things like acupressure, heating pad, yoga, hot baths, nothing else is working, then I might take an opioid. But I try to be more holistic with it. So twice a week, at least twice a week, I'm doing IV fluids. And the IV fluids have just been a lifesaver. I used to go to an outpatient infusion center that did them for me. And the problem with that was I still work. A lot of people in my situation don't, but I do. And it just wasn't convenient to schedule around work, because a lot of times the day I had off was a day I actually felt good and didn't really need the fluids and the medications. I need it on those evenings when I get home from work and I'm exhausted and my body is screaming at me. So I do them at home now. Anyway, I have a port implanted in my chest. Right now it's accessed with a needle that has a nice long catheter on it. It is a central line, meaning it goes into a central vein in your chest. Mine goes into the superior vena cava. It lies right outside the heart, so it's very important that it be kept extremely sterile. The technique has to be very sterile, and everything that goes in you has to be very sterile. And one of the things that's really interesting is my IV fluids. The pharmacy prepares it by removing all air bubbles, so I don't accidentally infuse air into my heart, which would go to my lung and cause a pulmonary embolus, which I've had before and was lucky to survive. So we don't want to play that game again, because a lot of people die from those. Anyway, I have spiked the bag with tubing and threaded it through my lovely little IV pump here. And this will be hooked up to me here in just a minute. I'm going to turn on my pump, so you're going to hear some beeps and squeaks. Beep, beep. These are just amazing. And I'm going to unlock it. Got my own secret code. Like it's a big secret. Okay. And yes, I'm going to accept that this is a critical care area. Blah, blah, blah. Now, it wants me to prime it. Well, this is very important to do. Let me take a lot of times the tubing, that's the other thing when you have a central line, has to have an air filter to prevent air embolus. So most of the tubing comes with that built in, but this time they didn't have the tubing that had that built in. And I grabbed the wrong piece of tubing here, but I happen to have it in a drawer. Hang on just a second. Yes. This is filter that I can add on to my IV tubing. And there's no reason to waste that pigtail either that I opened accidentally. It shows me an arrow down, so I know which way to put this on. So when you uncap one end, these are hard to get off, by the way. That is now sterile. Do not touch it. Uncap this one. That is now sterile. And not to be gender biased, but this is a male and this is a female, and he's going to go inside her. And the little cap screws over. Ta-da! And well, since I'd already opened up that other little pigtail, I'm going to use it, or else it'll just go to waste. And it's kind of the same situation. Keep sterile to sterile. That's all you can do. I am in the medical field, so I've been doing these type things for over 30 years. So if it seems like I'm just through it, that's why. I'm just very accustomed to it. So now I'm going to prime my tubing. And I always put the end of mine inside here so I don't get my bed wet. And now I'm going to hit prime. And basically what that does is it's going to flow, maybe. I have something clamped shut because I clamped it shut a minute ago while I was putting everything together. Go figure. It's idiot proof, which is good because, you know, I have a brain tumor. Okay. Let me shut it up and let's prime. 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 Okay, it's like 50 screens. So, you know, you can hear it. Can you hear it? It's priming. Okay. So it's going to prime and liquid will start coming out in there in a minute after it primes through the whole IV tubing. Once it primes the whole IV tubing, I will flip the tubing. Sorry, I keep putting a shadow on my face. I know. I'm terrible at this. I got to get real lights. But once I get the tubing primed up, I can see it coming up through the filter now. Once this starts, now it's dripping in the bag, see? Okay. But am I through? No. Now I'm going to flip the filter the other way because sometimes it can get air caught in it. So it's just a little trick, I know. Flip the filter. Make sure you're not getting any air bubbles trapped, and then flip your filter back up again, and it would catch anything that might have been missed. I look down my tubing. I look for air bubbles. I see nothing missed. I think we're good. So we're going to finish the prime. Okay. Yay. Okay. I'm going to repeat my last infusion. So now what I have to do is I have to prime my port. This is an alcohol cap. This alcohol cap stays on when it's not in use to help keep sterility. But now it's not in use, so I'm taking a clean alcohol swab. I've removed that little screw cap and I am going to clean this. Like I said, sterility is very important. I washed my hands thoroughly before I even started this, and I did hand sanitizing gel. So I double wash. Okay. This is nice and clean. And so now I will take a sterile saline, and I'm going to get the air out of this syringe. And these are sometimes hard to do one-handed. This screws on, and it's a male to female as well. It just screws in. I unlock all my little buttons, and now I can inject saline into my port. And this is very important for checking placement. I can taste the saline. A lot of people can as you inject it. Now, if you're squeamish about blood, this is where you want to turn away for 5-10 seconds, because once you do about half the injection, you're going to draw back and you're going to look to make sure you get blood. Sometimes you get a little blood. I'm going to flush it a little more, and then I'm really going to draw back hard. And now it's being stubborn. Give it another big zhoosh. And now we got semi-decent blood return. This happens sometimes that you don't get great blood return. So what I do in that case is, okay, I didn't get great. I got some blood return, but I didn't get great blood return. Checking my placement. My needle is in place. Sorry about my pumps, man. Taking too long. I'm going to take yet another flush. Let me grab another alcohol. One thing about it, when you do this sort of thing, you have a stash everywhere of supplies. So I'm going to take another alcohol wipe. I'm going to take this syringe off, and we're going to clean it again. Okay. Flushing it again. Now I can taste the saline, so I know it's in. The needle's in the right place. Sometimes there can get little clots, little fibrin sheaths that get on the end of your catheter, and that's why you don't get a good blood return, but mine always will cooperate with me. If I give it enough reassurance that it needs to. It's being a little more sluggish than usual. And I hate that when I'm trying to show an example, but you can see, maybe you can see the blood in the line. But there's definitely blood in the line coming back. And I'm pulling this because I'm noticing that there's air in the line. And that has me a little concerned. When in doubt, you don't use it. So, maybe aborting this one and having to change the needle. So a lot of times when you can't get blood back but you've tasted saline, there is a trick. And the trick is infusing. And so this is what we're going to do. Because I'm getting blood back, I have no problem getting blood back from this catheter at all. So, I mean, it's resistant, but it is coming back. So, I'm going to take the end that I primed, and I'm going to take an alcohol wipe, another sterile one, clean the tip really good. And I'm going to put this tubing on here. Now, let's turn on our pump. Lots of little screens. Okay, so what will now happen is I'll let that infuse for a few minutes. If your needle has dislodgings in the skin, it'll burn like fire when you inject anything. So the needle is definitely inside the port. When I flush, I'm flushing without any resistance at all. It's very easy to flush it. I can taste it, so I know it's in the vein correctly. So more than likely what has happened, that's a low battery signal, it's fine. More than likely what's happened is that a fibrin sheath is formed on the end of the needle or the catheter, and that it's just being cantankerous to draw back blood. So in that case, we just infuse for a little bit, and it'll knock off any of that stuff that's on there, and then I'll be able to draw a ton of blood. I was at the hospital the other day, and the same thing was happening, and I told the nurse, I'm like, just let it infuse for a few minutes and then draw the blood. It'll be fine. So she did, and it was fine. So anyway, that's really it. That's what I do. And now I'll sit here. This infuses over 5 hours, and it'll get me nice and hydrated, which I really need. You can tell my skin is very papery thin, very wobbly. You can really tell under my chin when I get dehydrated. This gets very loose and I look like crap. But anyway, the brain today, not too bad, a little foggy. The hydration will help that. No double vision, not driving anymore because the doctors told me I can't. Driving causes me to have double vision because so much depth perception you have to do with driving, and all the peripheral stimuli of cars around, it just overstimulates my brain, and I get the double vision. And I don't get that at all with just everyday activities. Or if I'm riding in a car with someone and I put on sunglasses and just close my eyes, I'm fine. So no more driving for me. But anyway, that's really it for today. I'm not doing anything with the brain today. I'm just waiting on them to call me back with a surgery date, but I thought you might be interested in seeing what else I do on a daily basis. And that's really it. And, you know, I told you Max, He's really the star of the show. Well, he's here. Max. Max. He's kind of unconscious. Just a little bit. Tiny bit unconscious. Maybe it's a brain tumor. I don't know. He sleeps more than I do. My low battery's beeping at me. So there's my little pump. And that's it. And that's my big belly. That's my big pancreas. This is a close-up of the port. It's flowing like a charm. Anyway, oh, yeah, I'm blocking half the picture there. Novice vlogger. Yeah, I'm 54. You gotta give me I mean, we didn't even have cell phones when I was 20, okay? So just give me a break. I'll get it figured out. We'll be doing lots of vlogging leading up to the surgery and at the hospital and during the recovery. So I just hope this can be a fun vlog for people with the pineal gland cyst, because honestly, some of the ones I've watched, no offense to the people who put them out there, a lot of them are very, very, very long, and a lot of them are very, just not a lot of everyday. They're kind of textbooky, and I don't want to be that way. So I'll try to throw in a snippet of knowledge here and there. I was a neuro ICU nurse for 20 years before I decided to go back into an anesthesia program and become an anesthetist. So neuro, I know all about all things neuro. I thought till I found out I had this, and I never even freaking heard of it, okay? What does that tell you about how rare this thing is in my brain? So anyway, I will vlog more tomorrow. I hope everybody has a great day. And remember, if you feel weird, if you have these symptoms, check your brain. Don't be afraid to check your brain. I should have checked my brain 6 months ago, because 6 months ago I started saying, I think I have a brain tumor. Oh, I'm overthinking it. I'm being dramatic. I can't. It's just because I used to be a neuro nurse. I just think I have a brain tumor. Check your brain, okay?